Welcome back to the big developing story. Global swine flu has now been declared a pandemic by the World Health Organization.
Well, the WHO said that the H1N1 swine flu virus has infected almost 28,000 people in 74 countries. It's the first time in 40 years that the WHO has declared such a pandemic. Well, joining us on the phone line, Dr. Randeep Guleria, Professor of Medicine at the All India Institute of Medical Sciences. Good evening, sir. Thanks very much for speaking to us. In simple terms, what does this imply for people in the country?
What it basically means is that the infection which we're having right now by the new H1N1 virus is increasing in number. It's spread to more parts as far as the WHO region is concerned. And the initial feeling that one would be able to contain the infection quickly has not really borne out, and the number of cases has continued to increase. And in a short span of time, we have reached almost 28,000 cases. So it means that globally, the number of cases is increasing all over the world.
Right, we are seeing increasing number of cases being reported from India. Should this be of specific worry for us?
There is a cause of concern because now you see, initially we were having cases which were what one would say is imported cases. People who are coming in from the US or from other countries where the outbreak was occurring. But now we've started having cases which are persons who have come in contact with these people. And there is now what I would say is homegrown or cases which have occurred in our own community, meaning that the virus is now spreading in the country in people who are coming in close contact.
So one final question, what makes the swine flu potentially more dangerous than a serious cold or a cough and cold, because a lot of the symptoms are similar?
Actually, currently all the symptoms are very similar. And if you look at the number of mortality, it is very low. So it is a mild illness in people who are healthy, and they usually recover with minimal or no treatment. In the elderly or people with underlying chronic illness, it can be a more severe form of illness. So although we have a large number of cases because there is no inherent immunity to this new virus, the virus still has not got the ability to cause a lethal disease. It just causes a mild illness, which at times is self-limiting, and most people recover. The concern is that we have a large number of people getting infected, and this is occurring in the summer months in the northern hemisphere. So as monsoon and winter occurs, we may see an increasing number of cases.
Dr. Guleria, thank you very much for joining us with those details. H1N1 now been declared by the World Health Organization a global pandemic.